After years of working with pain and inflammation, I created these blends to support the nervous system naturally. Now we're going to hop in and talk about the different oils and how I blended them, the pieces that come together. And so it gives you the background of each of these oils. Let's talk about the inflammation and autoimmune blend. So of course we start out with lavender because it's used to balance this blend. I am going to say that this particular blend is heavy on the physical side of that triad because we are dealing with inflammation and physical responses. We're not diving into any of the emotional side of this. This is actually one of our most popular blends because it is specifically for pain management. But one of the things I want to point out right from the beginning is that I selected these based on what I knew that they worked with. So lemongrass is for inflammation, rosemary is for bone, peppermint is for nerves, marjoram is for muscles, and birch is like having aspirin. So I was looking at bone pain, muscle pain, nerve pain, and trying to pack all of that together with something that could help with inflammation and pain all together. So that's why those are all put together in this particular oil. So lavender, of course, is used to balance the blend. Lemongrass is fabulous for overall support of the body's natural inflammatory response. Rosemary is for bone and joint comfort, commonly associated with stiffness or achiness or arthritis. Peppermint is for occasional nerve-related discomfort, anything that has to do with nerves being inflamed or pinched by muscle or skeletal or anything like that. Marjoram is for muscle support, any type of muscle pain, trigger points, stiffness, achiness, marjoram is really great for. And then birch is to support comfort with traditionally associated aspirin-like compounds. This is what we call our green oil, because of the green label. So some other information and contraindications. If the pain the person is experiencing is truly physical, then this oil helps support a noticeable reduction in discomfort, often reported as a meaningful shift on the pain scale. And so I used to tell people it could drop pain 2 points, but that's making claims on oil that is FDA non-compliant. So most people, their pain will drop. It can be varying depending on the person. It also decreases discomfort associated with neck tension, range of motion issues, shoulder tendon related discomfort, back discomfort, foot discomfort, pain in all of your joints, pain in your tissues. It is a strong blend. Make sure your client likes the smell and use about 10 drops around the body in areas of discomfort or in a carrier oil. So what that means is you can put it directly on the area that hurts, but 3 or 4 drops actually does what you need it to do. You don't have to sit there and drop 20 drops into that area. And it can be placed in lots of different areas. So shoulder pain, knee pain, headache, back of the neck, low back, it can be placed in all of those places. As far as I teach where to place these oils for the greatest effect, this particular oil, place it where they hurt. And that's the best thing that you can do for them. It is a localized area oil.